The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Thank you for joining me on this Friday, January the 8th, 2021, for another episode of My Story Living with Lupus podcast. Today's episode is all about doctors' worry about patients reading their clinical notes. Now, I have to admit myself that I'm the one who always go up to my doctors and say, let me see my clinical notes. And I read them and we have a conversation about it. So I really wonder why doctors are so worried about patients reading their notes. We'll find out. So you know what I want you to do. That's right, from the United States to Central Macedonia, Greece. Get ready to grab your cup of coffee, your cup of tea, and to my listeners late at night, you know I appreciate you. So get ready to grab your favorite glass of wine and come on and join the conversation right here on My Story Living with Lupus podcast. We all know the benefits of apple cider vinegar. Now, you guys know that I'm a vegan and that I have lupus along with other health issues. I used to take ACV every morning before I worked out, but eventually the taste of ACV got to me and I had to look for another alternative. And that's when a friend of mine turned me on to Goli. Goli is the first apple cider vinegar gummy. They give you all the benefits of ACV without the taste. That's right. Goli is vegan, gelatin-free, gluten-free, and 100% organic. And the vitamins and the ACV in Goli promotes a healthy heart by maintaining a healthy cholesterol range, controls blood sugar levels, and also curbs your appetite. And the best part about Goli, for every cell generated, a child in need receives a 6-month supply of essential vitamins with Vitamin Angels. So, if you don't believe what I'm saying, I'm going to give you some information so you can try Goli for yourself. Here's a promo code you can use. It's SUELYN1. That's SUELYN1. 10% off of your initial purchase. Also, I'll leave a link in the description in the podcast. So, why don't you go and try it for yourself? You won't believe how good it tastes. That's Goli. How many times have you snuck into your chart to read what the doctor states? I know I don't sneak. I do it all the time. I tell them, let me see what you're putting down. And then if I have any questions, I'll say, well, what do you mean by this? Well, why do you believe this is happening because of this? But some of us have to admit, even when we're hospitalized, we will look in the charts and see exactly what the doctor is saying. Now, doctors are worried about patients reading their clinical notes, as reported by Medscape. And I can understand that because some patients can misconstrue what they're reading, or they may not understand the medical terminology and think that it is really something gravely wrong when it's not. But let's delve into this article, as I stated before, written by Medscape. Well, I should say appeared in Medscape. Now, patients will soon be able to read the notes that physicians make during an episode of care, as well as information about diagnostic testing and imaging results. Tests for sexually transmitted diseases, fetal ultrasounds, and cancer biopsy. This open access is raising concern amongst physicians. As part of the 21st Century Cures Act, patients have the right to see their medical notes, known as open notes. I'm going to repeat that one more time. As part of the 21st Century Cures Act, patients have the right to see their medical notes. If you can recall back in previous episodes, I always told you guys what's inside that chart is yours. What's outside is the doctor's. The policy will go into effect on April the 5th, 2021. The Department of Health and Human Services recently changed the original start date of November the 2nd, 2020. The mandate has some physicians worrying about potential legal risk and possible violation of doctor-patient confidentiality. In a Medscape article discussing the open notes mandates, physicians expressed their concern, but also some of the positive effects that could come from this. Now, potentially more legal woes for the physician, right? Well, a key concern raised by one physician commenter is that patients could misunderstand legitimate medical terminology or even put a physician in legal crosshairs. And I'll give you an example. A medical term such as spontaneous abortion could be misconstrued by patients. A physician might write notes with the idea that a patient is reading them and thus might alter those notes in a way that creates legal trouble. This layers another level of censorship and legal liability onto physicians who, in attempting to be PC, may omit critical information or have to use euphemisms in order to avoid conflict, one physician stated. Now, this physician also questioned whether notes might now have to be run through legal counsel before being posted to avoid potential liability. Another doctor questioned how physicians would be able to document patients suspected of faking injuries for pain medications, for example. Could such documentations lead to lawsuits for the doctors? As one physician noted, some patients or drug seekers, some refuse to aid in their own care. Some are malingerers, not documenting. That is bad medicine. The possibility of violating doctor-patient confidentiality laws, particularly for teenagers, could be another negative effect of open notes, says one physician. Won't this violate the statutes that teenagers have the right to confidentiality evaluations? If charts are to be immediately available, then STDs and pregnancies they weren't ready to talk about will now be suddenly known by their parents. Now, one doctor has already faced this issue. They already ran into this problem once. Now the doctor is stating, I warn those on their parents' insurance before I start the visit. I have literally had a patient state, well then, we are done, and leave without being seen due to it. Another physician questioned the possibility of having to write notes differently than they do now, especially if patients have lower reading comprehension abilities. Now, you see why I did that episode on health literacy. You see the way that some doctors think that they have to, well, if you are unable to comprehend, they would have to write the notes where you could simply understand, maybe in layman terms, what they are saying. But for myself, I've worked with doctors who, when they had patients who were addicted to certain painkillers, they would tell them right off the bat, no, I am not prescribing you any more of, I'm just using this as an example, oxycodone, or back in the day it was T4s, Tylenol 4s, T4s and T3s that patients were seeking. And doctors would simply tell them, no, I'm not going to write any more scripts for you for this, and I'm going to note it in your chart, not to give you, as an example, I'm using this as an example, T4s or T3s. Stay with me and we'll discuss this even further. You know, those of us with lupus experience hair loss, thinning hair, either from the illness or the medication we take. I have the perfect solution for you. It's called Vitalize. Yes, Vitalize can help you. They are in the business of growing healthy hair. They have a hair system that can help you, and even better, they have a new and improved edge control gel. That's right, ladies. There is no flaking. It lays down the edges and also protects it from heat. But wait 1 minute. Most importantly, the edge control has the award-winning hair growth ingredient retin sol. Addition to the 3-part scalp treatment system, there is a silk pillowcase for you to lay those growing locks on. Shampoo, conditioner, and multivitamin gummies. You can see reduced shedding in 2 weeks. You heard me. And most see results in 4. To see proof for yourself, go on over to vitalizehair.com. That's vitalizehair.com and use the referral link listed in the information box on this podcast. And we're back. Now, do you think open notes can erode patient communication with their physician? Well, one physician questioned whether it would lead to patients being less open and forthcoming about their medical concerns with doctors. The main problem I see is the patient not telling me the whole story, or worse, telling me the story and then asking me not to document it, as many have done in the past, because they don't want their spouse, family to read the notes, and they have already given their permission for them to do so for a variety of reasons. He commented, this includes topics of STDs, infidelity, depression, suicidal thoughts, and other symptoms the patient doesn't want their family to read about. Some patients envision a positive development. A doctor working in the U.S. federal healthcare system noted that open access has been a part of that system for decades. Since healthcare providers work in this unveiled setting for their entire career, they usually know how to write appropriate clinical notes and what information needs to be included in them. Now it's time for the rest of the medical community to catch up to a reality that we have worked within for decades now. The world did not end. Malpractice complaints did not increase, and physician-patient relationships were not damaged. Living in the information age, practices like private notes were surely going to end at some point. One doctor who has been using open notes has had experiences in which the patient noted an error in the medical chart that needed correcting. Now, another physician agreed. I've had patients add or correct valuable information I've missed. Good probable outweighs the bad if we set limits on behaviors expressed by the personality disordered group. The majority of people don't seem to care and still ask me, what would you do, or tell me what to do? It's all about patient physician trust. Another talked about how open notes should have little or no impact. Here is a novel concept. Talking to our patients, he commented, there is nothing in every one of my chart notes that has not already been discussed with my patients, and I dictate speech to text my findings and plan in front of them. So if they are reviewing my office notes, it will only serve to reinforce what we have already discussed. I don't intend to change anything, he added. Chances are, if they were to see a test result before I have a chance to discuss it with them, they will have already Googled its meaning, and we can have more meaningful interactions. The doctor further went on to state that he understands that this is anxiety provoking, but in general, I think it is appropriate for patients to have access to their notes, said another physician. If physicians write lousy notes that say they did things they didn't do, that fail to actually state a diagnosis and a plan, and they do often do, that is the doc's problem, not the patient's. What are your thoughts on this? Do you think open notes are a good thing or a lousy thing? That's why we can all revert back to podcast 168, Health Literacy, and other podcasts that I've spoken on regarding patient information. So, what are your thoughts on this? When we return, family doctors license suspended after refusal to wear a mask when seeing patients. So stay with me. All right, and we're back. Let me tell you guys something. Today is Tuesday, January the 5th, and I'm pre-recording this episode for Friday based on the fact that I don't know if they're going to admit me into the hospital on Wednesday. If you listen to episode 168, I talk about health literacy and I explain why I have to go to the hospital, and I don't know if I'm going to be admitted or not. And while I'm, doing this, recording this podcast, I'm prepping. I have been unable to eat anything since November. If I try like I stated, if I try to eat anything solid, I get nauseated really bad. And the pain starts to occur in the right upper quadrant of my stomach. And it's a blockage. They don't know what type of blockage it is. I know if you've already listened to this podcast on Wednesday, I talk about it. It occurred after a flare in November, and I talked about that also. I couldn't bounce back like I normally do. Then came the pain, the nausea, the diarrhea, and all sorts of things started happening to me. But right now, as I stated, while I'm doing this recording this podcast, I got a little bit lightheaded. So if it sounds like I'm rambling, it's just me trying to get myself together. And I did. I'm on all liquids now. And that doesn't bother me. It's just that the nausea and the pain comes in every now and then, and I'm trying to push through. Monday, I seen my cardiologist, and he asked me, was I going to be admitted? And I told him at this point in time, I did not know. And he gave me a message to tell the doctor that if she decides to admit me, to please call him and let him know so that they can come in and monitor my heart. And more than likely, if I am admitted, and depending on what they find, and if they can't get it right then and there, they'll probably schedule me for surgery. And more than likely, I will, they would have to segregate me from other patients due to all of my diagnosis plus my compromised immune system due to lupus. So that's what I'm going through right now. I'm trying to push and forge ahead. But I just started to get a little lightheaded, and I went and grabbed me some broth to drink to get me back on the road. So let's talk about an Oregon doctor suspended after refusal to wear a mask. That's right. This is also reported by MedPage that the Oregon Medical Board has suspended the license of a family doctor who proclaimed at a political rally that neither he nor his staff wear masks while working in their Dallas, Oregon clinic. The board had not answered Medscape, reported by Medscape, not MedPage today. Medscape Medical News requests for more information by publication time, but the board indicates on its website that it voted on Thursday evening to issue an order of emergency suspension. The board voted to immediately suspend the doctor's medical license due to the board's concern for the safety and welfare of the doctor's current and future patients. The order is in effect until otherwise ordered by the board, the directive stated. The order prevents the doctor who has been licensed in Oregon since 2000 from practicing anywhere in the state. Now, Oregon had exceeded 1,000 deaths from the pandemic and had confirmed more than 83,000 total cases. Now, comments made at the political rally of guess who? You got that right. You already know who I'm talking about. Now, the doctor who owns the Southview Medical Arts Clinic in Dallas, spoke on November 7th outside the state capitol in Salem at a Stop the Steal rally in support of you-know-who, and said that neither he nor his staff wear a mask while working in their clinic. That violates an order in Oregon requiring healthcare workers to wear face coverings in healthcare settings. We have been utterly duped, and I want you to know that this is insanity, and the purpose was only to shut down the American people, the doctor stated at the rally. This is a threat to your freedom, a threat to our Constitution. I petition all of you, take off your mask of shame. He told NBC in an interview on December the 2nd, I have absolutely zero problems with infectivity, and I have completely successful treatments. So I ask, what is the problem? Why would I be demonized if I know what I'm doing? The order of the suspension gave some examples of practices at his clinic. It stated that a patient who contacted the clinic in July to get advice on being tested was told asymptomatic persons should not be tested, that wearing masks does not prevent transmission of the virus, and was directed not to self-isolate because being around other people would provide the patient with immunity to the virus. Now, on July 23rd, after questioning the advice, the person was dropped as a patient. Additionally, the suspension order said that the doctor repeatedly told elderly and pediatric patients incorrectly that it was very dangerous to wear masks because masks exacerbate COPD and asthma and cause or contribute to multiple serious health conditions, including but not limited to heart attacks, strokes, collapsed lung, MRSA, pneumonia, and hypertension. Now, you see why some people don't trust physicians? He took this a little too far. He was making a political statement and informing his patients incorrectly. The doctor's stance also goes against the directives of the Federation of State Medical Boards, better known as FSMB. In an October statement, The FSMB Board of Directors said when seeing patients during in-person clinical encounters, physicians and physicians' assistants have a professional responsibility to wear a facial covering for their own protection as well as that of their patients and society as a whole. Now, they further state FSMB told Medscape that the organization was not aware of any other actions taken against the doctors for the pandemic-related complaints. He stated that in an October survey of member boards, FSMB asked whether they had received complaints about doctors failing to wear masks while caring for patients. Of the 33 boards that responded, 21 confirmed that they had received complaints about maskless doctors treating patients. The survey did not ask for a total number of complaints. Now, if it was me and my doctors came in without a mask, I would tell them, oh, nope, you stop right there. Go get you a mask. If not, I'm out of here. And did you wash your hands before you touch me? That's what I'm talking about. But see, there's two parts to blame on this situation, I think, and it is only my opinion. For number one, the patients should have got up when they said the doctor came in without a mask. Before they got up, they should have said, where is your mask at, doctor? It's mandated that you wear a mask before you see patients. And if the doctor said, oh, no, I'm not going to wear no mask, I would have said, okay, the patient should have said, okay, well, my behind is getting up and walking out of here. And then I would have got on the phone, called and reported the doctor's office, and then I would have looked for another physician to go to. I'm not just going to sit there and let you see me. No, I would have went to the emergency room or something, but you're not going to see me without a mask. And prior to before that, more than likely, the doctor probably went to the hospital to do rounds and probably didn't have a mask on. And we all know that there are airborne germs in the hospital. Now, the doctor leaves the hospital. Did you know if the doctor washed his hands or not from leaving the hospital? More than likely not. More than likely not. The doctor didn't wash his hands. So he's bringing those germs back into his practice. Then he's touching his patients and just spreading the germs. No, patients got to learn to say, oh, hecky no. Get up. I'm out of here. I'm not going to let you touch me. Where's your mask? But like I said, all of my doctors wear masks and they do wash their hands before they even see me, touch me. And when they come in the room, I tell them you better put some of that disinfectant hand sanitizer on you too, because you touched the doorknob. And I don't even touch the doorknob when I walk out of the doctor's office. I get a paper towel and then I touch the doorknob with the paper towel and throw the paper towel away. But no, not with my bare hands. I need another sip of my broth. So just one moment. Okay. Now, the CDC is clear on the benefits of wearing mask. The CDC issued a statement December 4th urging universal mask wearing for the first time since the pandemic began. The agency concluded in a November 20th report that 7 studies in various settings confirmed the benefit of universal masking in community-level analysis in a unified hospital system, a German city, a U.S. state, a panel of 15 U.S. states and Washington, D.C., as well as both Canada and the U.S. nationally. Each analysis demonstrated that following directives from organizational and political leadership for universal masking, new infections fell significantly. Now, complaints against providers who do not wear masks have been lodged across the country, with many state medical boards, the Atlanta Journal-Constitution reports, and reports calling out maskless providers have surfaced repeatedly on social media. That's right, I don't blame them. Last week, Medscape reported that a celebrity doctor who has repeatedly advocated for mask wearing was vilified for flaunting social distancing and mask wearing protocols on a birthday boating excursion. The story noted that an Oregon nurse who bragged on TikTok about not wearing a mask was put on leave at the end of November. And that's another thing that gets me. Why would you go on social media and parade that? You know, my father used to say, you can be an educated fool. And some people are educated fools. You think you know everything, but you will run to social media to blast everything you're doing, and it can cost you your livelihood, which it did. When we return, I will be closing out, so stick with me. All right, I really appreciate you guys joining me for another episode of My Story Living with Lupus podcast. One thing I want you to remember is that strength doesn't come from what you can do. It comes from overcoming the things you once thought you couldn't. I'm wishing you a most peaceful, safe, and oh so blessed weekend. I'll see you next week for another episode of My Story Living with Lupus podcast.